attending today's session, and welcome all to the first of the 7 Primary Sense lunchbox sessions. Today's session will focus on how to improve your practice PIP QI improvement measures using Primary Sense. My name is Harry Howell, and I'm the Senior Project Officer here for Primary Sense at Gold Coast Primary Health Network. Before we start, I would like to acknowledge the traditional custodians on the land upon which we meet virtually today and pay my respects to elders, past, present, and emerging. And just some housekeeping before we start. Today's meeting is being recorded, so it may be shared as a resource for future use. So please make sure your cameras are off and your mics are muted. There'll definitely be an opportunity for questions at the end where I will turn off the camera and obviously turn off the recording also. So if you can please save any questions till the end of today's session. Thank you. So like I was saying, today's session is focused on how to use Primary Sense to improve your PIP QI practice improvement measures. So before we start, what is PIP QI? The Practice Incentive Program Quality Improvement, or PIP QI as we know, was established on the 1st of August 2019. It is a payment to general practices that participate in quality improvement activities to improve patient outcomes and deliver best practice care. There are 2 components as a general practice needs to meet to qualify for PIP QI incentive payments. The first is to participate in continuous quality improvement, and the second is to provide the PIP legible dataset to your local PHN, and that is done through the Primary Sense tool. In today's session, we'll focus on how you can use Primary Sense to actually improve your PIP QI improvement measures. As you can see on my screen currently, there is numerous reports practices can view to improve their PIP QI improvement measures. I will first show you those in this PowerPoint slide deck. Then for the second half of today's session, I will actually share my screen and show you how to use these reports in action. If you do click on the Primary Sense desktop application on a workstation in your computer by clicking on Reports, just like this screen here will appear. One report you can run is PIP QI report 10 measures. That will show you your practice PIP QI data across the 10 measures. And that data is as of a few minutes ago when the last Primary Sense extraction occurred at your practice. Another report you can run through Primary Sense, once again, clicking on Reports, is the accreditation reports. These targets are from the 5th edition of the RACGP standards for general practice. This report includes the practice data and also the RACGP minimum targets. The indicators included in this report are the active patient number, as defined by the RACGP, which is 3 visits in the last 2 years. It also includes allergy status recorded, smoking status recorded for people aged 10 years and older, alcohol consumption status recorded for people aged 15 years and over, BMI recorded, and ethnicity recorded. This report will show you your practice data, then also compare that against the RACGP minimum target. The Primary Sense tool can help identify patients who have missing PIP QI measures also. There is 2 reports in Primary Sense that can facilitate this. The first is patients booked in with missing PIP QI measures. I'll show you on the next slide where that report is located on the Primary Sense desktop app. This report will scan through your clinical software, so Medical Director or Best Practice, and search for any patients with upcoming appointments in the next 2 weeks who have any missing PIP QI measures. And this only includes active patients, once again, based on the RACGP definition of 3 visits in the last 2 years. The second report which can assist with PIP QI is patients missing PIP QI or accreditation measures. This report lists active patients who are missing 1 or more accreditation or PIP QI measures. This report will not show patients who have been flagged as inactive in your clinical software. In this report, there is a filter for RACGP active, which I will show you in the demonstration at the end. Once again, if you click on Primary Sense Reports in the desktop app, the first report I was previously talking about is located here. Patients booked in with missing PIP QI measures. The second report is located here. Once again, Primary Sense Reports will give you this screen. And then if we click on Patients Missing PIP QI or Accreditation Measures. Also in the Primary Sense tool, there is continuous quality improvement templates, examples, and also guides. Included in the templates are generic CQI action plans and PIP QI meeting templates. There's a selection of pre-filled CQI action plans that you can edit to support your activities in the practice, then also some guides on how to use the Primary Sense tool. If you click on the Primary Sense tool, desktop app in the practice and click on CQI, this screen here will appear. If you click on templates, that will give you the templates. If we click on examples, here are some examples of a CQI activity. And if we click on guides, here are all the guides for Primary Sense. If you double click on any of these, they will open in a Word document. It's also important to note any reports or templates or document that you open in Primary Sense is automatically saved to your desktop also. So to view that, you simply click on My Documents under File Explorer on your computer. In the Documents section, there will be a Primary Sense folder that was being created by default when your IT provider installed Primary Sense. If you double click on this folder, you will see there's two subfolders, Quality Improvement and Reports. In the Reports folder, that will include any report you have ever downloaded in Primary Sense. And in the Quality Improvement folder, that will include any quality improvement documents you have downloaded in the Primary Sense tool. I will now stop sharing my screen and I will share my desktop and I will show you the tool in use. You should see an image of the beach on your screen. Is that correct with the Primary Sense desktop app?
Yes.
Thank you. So as I was saying before, this is the Primary Sense desktop app that you have installed in as many workstations as you want in your practice. Your IT provider can also install this on additional workstations if you wish at your practice. If you click on Reports, here are all the Primary Sense reports that you can run in the Primary Sense tool. First, I will show you the PIP QI report, 10 measures. By simply double clicking, this screen here appears, which means the report is currently downloading from Primary Sense, and it will open in your default browser, just like this. And here is the 10 quality improvement measures for your practice, and also the regular patient count, once again defined by RACGP as 3 visits in the last 2 years. And as the Primary Sense extractor runs once every few minutes, this report here will also update once every few minutes. At the top of each report, you can see there's 4 blue boxes. These appear in any Primary Sense report you ever view. And if you click on those, they do expand down and they show you which patients are included in the report you're currently viewing. What data is in this report? How do we use this report? and what are the ACG patient complexity levels. If we close that one, the next report we will open is the accreditation report in Primary Sense. If I click on reports, once again, we have this screen, and this time I will click on accreditation. Double click. This screen here is currently downloading. And here is the report here for accreditation in your practice. As you can see, if I want to know which patients are included in this report, I would click this, and it shows me all patients that are recorded as being active in the practice software. And active is defined by RACGP as 3 visits in the last 2 years. It shows me the active patient number of the patients in my practice, then also gives me my practice data against the RACGP minimum target. So as you can see here in the dummy data, which we are using for the PHN, the BMI recorded in this practice is 84.96% against the RACGP minimum target, which is 75%. If I close that report now, the next report we will view is how to identify patients in your practice who may have missing PIP QI measures. The first report that we can run to facilitate that is this report here, patients booked in with missing PIP QI measures. As I was saying, Primary Sense will identify any patients who are booked in to visit the practice in the next 2 weeks. It will then show you here what day those patients are coming in, and of the 10 PIP QI measures, what is not recorded for those patients. Currently here at the PHN, there's no patients coming in to see us. As you can see here, no data variable, but as you view this report in your practice, you would see for the next 2 weeks what patients are coming in, their phone number, what day they're coming in, who is their GP, obviously age, Indigenous status, and then here we have the 10 quality improvement measures. Where there is an N in the field, that indicates not recorded. So you might have John Smith who's coming in tomorrow, and you might see for BMI recorded here, there will be an N. That indicates that John Smith doesn't have BMI recorded. And the final report that I will run today is if we click on Primary Sense reports, patients missing PIP QI or accreditation measures. If I double click here, and this is the report here which just opened. So this report removes the filter of patients coming in to the practice in the next 2 weeks and shows all patients who are marked as active in your clinical software who have any of the missing PIP QI or accreditation measures. This report here might be quite large. As you can see here, Primary Sense shows 25 patients per page in a table. But one little trick you can do rather than have 54 pages is simply click Show Me All Patients. Just like that, you'll then see all your patients in one table. You can also sort in Primary Sense. So if you wanted to see of your patients who currently doesn't have a BMI recorded, if you simply click on the word BMI, it will bring all those patients to the top. So as you can see there, N means not recorded. But as you can see here for this first patient, once again, this is dummy data, T. Kelly, they are not actually RACGP active, which is 3 visits in the last 2 years. So all I want to see is patients who are RACGP active, which goes towards your accreditation and PIP QI reports. So once again, I just clicked RACGP active. That appears as yes, so they're active. I don't have BMI recorded. You can also see in Primary Sense at the top here, there is options to export to Excel and also export as a CSV. So any report that you do view in Primary Sense can be exported to Excel or CSV. If I click on this button here, I want to export this report to Excel. You'll see there it downloads and it tells me it has downloaded. I'll click close. I will then double click on the Excel document. And as you can see here, it does open in Excel. The exact same data, but now it's in Excel. And we can do some manipulation in this to make this more easy to review at the practice level. One thing we can do while the document is being verified by Microsoft here at the top, you can look at the patient phone numbers and when they last visited the practice, and also are a CGP active. I will click Enable Editing as I want to edit this document. I will then simply click on row 2, just like this. Click Data. Click Filter. And that puts filters on all of these headers here. All I want to see is patients who are active. So I will first select active, click this little button here and select yes. Only show me patients who are active. I want to see patients who don't have a smoking status recorded. So I will click this little button here and select no, not recorded. So here's all the active patients in my practice that don't have a smoking status recorded. But I want to focus on those patients aged 50 years or over. So what I will do is click on age, select all, and then select any patient who is aged 50 years and over. And now I see patients who are aged 50 years and over who are RACGP active and do not have a smoking status recorded in the clinical software. I will now close this and show you on the Gold Coast Primary Health Network website. It's the Launchpad here. If you click on Practice Support and scroll down here to PIP QI Quality Improvement Incentive, you'll here see some resources here which will support you in the practice. If we scroll down to QI templates, here are a list of QI templates which we have uploaded to the website. And if you click on health assessments, here are some ready to go QI templates for health assessments. So if you click the health assessments age 75 years and over, QI action plan, it'll download in a Word document and you can open and edit this in your practice. Likewise, there's ones here for immunization, COVID-19, cancer screening, etc. Also on our website, if you click on Practice Support and Using Primary Sense and click on Videos, there is numerous videos here of the Primary Sense tool in use. How to use reports, demonstrations of the tool, and then a video from Lisa Beecham, who is a GP on the Gold Coast, and how she used the tool in her practice over the last 3 years.